Good afternoon, everyone, and good afternoon, doctors. Thank you for joining us today. This is our lower secondary checkpoint GP project. Our research topic is does cholera have more prevalent effect in rural areas or in urban areas? May you now briefly introduce yourself, what you do, and your background. Over to you, doctor.
So hi Mohammed, I'm Ami. Nice to be here. This is this sport. My name is Omotola Akindipe. I'm the External Relations Officer for Gabinete Angola, and we're excited to be here with my colleagues and to really talk about this important topic.
My name is Neusa, Lazary. I'm the Chief of Public Health Department of Luanda Province. I'm a medical doctor. Health work is my specialization.
Thank you very much and good afternoon. My name is Paulo Muzuza. I'm a consultant at WHO. I am a public health specialist. I'm a medical officer also, currently managing the immunization program for the country. So this is
Now, we would like to start our question.
So doctors, are there any signs that cholera might be changing or becoming harder to treat in Angola?
Science. You can speak about the higher numbers, increase of numbers is one of the signs. For example, the cholera starts in one place and then spreads to the others. Is also one of the signs.
okay. Thank you very much. I think there are indications that if we don't take necessary measures, okay, the cholera situation may get even harder to treat because the basic factors are there, but if we don't take these basic factors into consideration, we risk having increase in the number of cases. Okay? So, yes, the sanitation part, okay, the basic sanitation of the communities, personal hygiene, these are simple and basic, but if we ignore them, okay, we have this probability of increasing or becoming even harder because now we have areas where there were no cases, they are having cases now. So what we are doing, what we are seeing is a situation where the place where we have cases, we do activities, prevention activities, the other places that we don't have, okay, probably we ignore them. Then the following time, the same place that did not have cases. So I think we should not only concentrate on the areas where we have cases, but even those that do not have cases, we have to do the prevention and social mobilization with the community. So that is what we can do too.
Thank you very much. Doctor, if I may, is there a pattern in the type of areas that seem to have the most cases of cholera? Let's say certain areas in certain parts of the country. Is there a pattern that you see? Maybe.
That's a very good question. Absolutely yes. Okay. What we've seen in because we are actually living in the outbreak now. Okay, we have seen pretty this comparative situation where the rural areas are more affected, okay, than the urban areas for obvious reasons. As urban areas, we're expected to have everything: water, treated water, piped water, sanitation is improved, and all these people are, aware. There's a lot of mobilization, sensitization. So we have, okay, more people concentrated in urban areas with minimum conditions to survive, unlike the rural areas where we have no toilets, no latrines, no treated water. There are rivers, people use water from the rivers which is not treated, and so the risks are there. So yes, the urban areas seem to have lesser cases as compared to the rural areas.
So the education and cultural factors. The rural areas, we have more cultural factors. We have not the same access to health facilities. For example, in the urban areas, you have clinics, the private, and then you have the public. But in rural areas, you have the public, but sometimes the people need to walk far to get this health funding.
Referring back to water, why is it sometimes hard to provide clean water during a cholera emergency? even with help from big organizations like the World Health Organization.
What he wants to say is that we have, for example, Luanda, we have UNICEF, we have all WHO, but even like this, we don't have the access of safe water for all people. This is one of the meds, or what you call, that is very simple, but in the paper. But to reach this, know the people. You know, for example, we are now in the center of the city, in the Kapuaku is a new area. The people build houses faster than the government can put all these facilities, hospitals, water, schools. Do you understand? This becomes also one of the problems for us.
Absolutely. Urban areas are expanding very fast in such a way that service provision by the state doesn't match the rapid expansion of the. So we have a number of people that have access to potable water, clean water, and most of these new suburban areas have completely nothing no water. So it becomes a challenge. Water provision is basic, but not every child, not every human being has this basic, source, which is really a challenge, and we need to see how best we can.
As Dr. Paulo said, the people in rural areas sometimes need to walk far to a river, and we need to see the conditions there. It's not a safe water. They don't have, for example, the aqua taps to treat the water, but in urban areas you can go and shop and you can find. Sometimes the people have more power to buy and not the rural areas.
So has climate change made it harder to control cholera outbreaks in Rwanda?
Yeah, in Rwanda and all of them, right? Because in Rwanda in January we started with the cholera, but then we had the rain.
Rainy season too.
Yes.
October 20.
Yeah, but now we started in January, but then we have a lot of rain. And then the rain is one of the factors because of the poor sanitation. We have then the contaminated water because of all these sanitation issues. And then it's a problem. When it's a rain season, the cases goes up.
Okay, so just to add on to what we were saying, it's quite simple, and I know that you have a project on open defecation. If you do open defecation, let's say in Kakwako, and then it starts to rain, what happens is it takes all of that to other communities.
Yes.
So if the person who did the open defecation is infected or has cholera, then the rain will just wash it, and before you know it, it hits different communities.
And then the drainage, the water goes to the sea. And we had a lot of places in Luanda that the people that lives to the beaches, they was affected. Yes.
Because of the water.
Oh yes.
And also, just to answer your, because you meant that question earlier on. So if you look at the map of Angola, where most of the cases are, it's along the coast.
It's Bengal in Rwanda.
No, it's along the coast. So it's Rwanda, Benguela, Kwanza, Sul, and
Also because
so it's all along the coast.
actually to
Yeah, the special for of course, Bengal, but at least the last
Kwanza
month
Sul.
or month and a half, most of the cases have been along the coast.
It has to do with the seas.
No, exactly as Liz mentioned. So
the drainage.
the drainage, each
All of the water from the rain goes to the sea.
You see.
And then people consume the fish.
A practical example I can give is that in rural areas, okay, there are a lot of many rivers, and people go to get water for use, okay, from the rivers. And the rivers are down, their homes are up there. When it rains, and most of the people do not have latrines, they do, open defecation, okay. So when it rains during the rain season, all this dirty goes into the river, and that's where the population get the water to do for everything, drink, bathing, drinking. Probably they don't even boil it, so the risks are there. So water issue along the ocean, even the rivers. So the situation of water is critical.
When it comes to the point of public defecation, it obviously boils down to the fact that a lot of citizens are not aware of certain factors that could cause cholera. So, what are the biggest gaps in public awareness about cholera that are still need to be addressed in not only Luanda but the whole of Angola?
Yes. The open defecations, the way we understand it is sometimes taken as cultural. There are communities where they think that's the tradition, you know.
Yeah.
They don't want latrines. To them, that's okay.
Yes.
And that is wrong. I think the best we can do is mobilization, sensitization. The risks are there. Sanitation, personal or public, should be priority to everyone. Okay. So we need to really engage the community traditional leaders, for instance, the opinion leaders in the community, to see, to talk to them, yes, to talk to them and analyze, look at the risks that are there if we don't take certain measures. So
Involve them.
involvement of
The people, citizens.
citizens,
They need to be involved.
traditional, religious, in the community. It's very good that we involve them so that we all take corrective measures.
So, what are the biggest challenges you face when trying to control a cholera outbreak in Rwanda? Yeah.
So water and sanitation is the. But we work as multi-sectorial actors. We have all the other ministries, not only the health. And then we involve all the other actors. We can't work alone. We are speaking about involving the leaders, the community leaders, the religious leaders, but we need to work with the environment ministry, the water ministry, because health can't put the water and sanitation. You can't. Then we must put, work together. Everybody does something, but all together.
This is very true. And one also, the challenge is that there's still people who don't accept, who still don't believe that there's cholera. You know, even after seeing, yeah. So this is a challenge. So we need to really engage the community through mobilization, sensitizing, involving them. Because sometimes when you go there as a health, personnel with they think it is yours, it's your problem, it's not theirs. So I think there's need to involve them, okay? Get the traditional leaders, community leaders, what we call ADERs, so that together we come up with strategies that to strengthen the community. So it's good that we also work on the minds of the people, talk to them, involve them. Community involvement is critical in resolving a lot of these issues that we have, either cholera or other diseases.
Yeah, we had also in Kapuapo, was the first municipality with cholera.
First cases.
This year.
This year, yes. And we had to make quickly a CDC with a cholera treatment center. And then we involved the community to work there, to do the cleaning, but of course we provide the training for them to work there, to clean, to do the surveillance.
Yes, surveillance, yes.
There was like reporting to the health department all the cases in community. They like alerts. Yes,
Yeah.
on the community. And also what we call contaminating the houses of the cases.
The cases.
And where we had deaths, they also was doing the contamination. Then we involve them on this process.
Absolutely. Involvement of the community is very important. That's why we have what we call oral rehabilitation points in the community.
In the community.
The whole idea is to involve them so that they understand and they assume they own that. Okay? It shouldn't look like it's the Ministry of Health, no, but it's a community problem, and so community involvement is critical. So these centers, treatment centers, are in the communities. Okay? People that are managing it are the people that are within that community. So that's how we are trying to involve them so that together we work out.
Even the church is also a place where you can do this sensibilization.
Yes.
You involve the religious leader, and then during the, I don't know if you call mass.
Mass.
Yeah.
During the mass, then you can speak about cholera, prevention.
You mentioned to me about communities that are being ignorant by the presence of cholera. I would like to know what myths or false information about cholera have you encountered among local communities? Yeah, which one?
Misconception, yes.
That doesn't exist.
Yeah. One of them is that they really think
They don't believe.
they don't believe it exists.
What do you think this is? What is the leading factor of their denial?
I think the denial is most of it is lack of education, lack of information. Okay. Of course, if you don't have the right information, you are left to guess. Is it this? So, there are a lot of myths also because of these unfounded rumors that go around. Okay. Rumors go faster than the
Yes,
truth.
it's the truth. Yeah, of course.
Yeah. So we have to look at the mentality and really inform the community what is supposed to. They need to know the information, real information, facts, and not
Something that people are naturally suspicious.
Yeah.
Suspicious.
That's what I think that's important. Sometimes they'll only believe when they see it.
They-
So a lot of the cases are in rural areas. So a lot of people living in urban areas who have not seen, for example, cholera treatment centers
Yes.
may not believe that they exist until they see it. During the COVID
COVID.
was very different because people could see things. Cholera, of course, what's been really good actually in Rwanda is that the work that the Neusa has done with all partners has been quite effective, which is why cases are shown down a lot. So people are naturally suspicious and they think, well, do we have cholera or not?
No, no.
So apart from the lack of education in terms of information that some people may have, there's also a need to understand that people are naturally going to question, is it real, is it true? And then of course, when you have that gap, it's very easy, for example, on social media to
Yes.
discredit it and then for people to believe.
And on the other hand, people, they believe in spiritual.
Yes.
Oh yes.
And this is the point. They are sick. They have the symptoms of cholera because normally they know at least, right? And they go to the church or they go for traditional treatment, and then you have the problem.
That's the biggest also problem because we have a number of people dying because of this delay.
Yeah.
Instead, you have the signs and symptoms. Instead of going to the nearest clinic or health first, they will first go take traditional medicines. They will go to the spiritual leader. When it is worse, complicated, that's when they run to the health. Center.
Yeah.
And most of the time it is late and nothing can be done.
Yeah. And the other thing is also the self-treatment. I have stomach ache and I don't need to go to the doctor. I go to a chemistry, I buy tablets and I take it. You understand?
Yes.
They also delay the symptoms, and when the symptom starts, is at, for example, midnight, and you live in an unsafe area. You can't leave your house midnight to go to a facility, and then until the 6 o'clock in the morning, you're dead. And we had in Kakwaku family of 3-4 people.
9 years.
Oh,
Due to the ignorance of one. You mentioned to me the ORS, the oral radiation system.
yes.
People living in rural areas, obviously they will not have access to medical centers that's close by your house. Let's say something happened at night. Would you recommend them to or do oral rehabilitation systems at home, or is there sort of some medication they can do at home sort of help stop some of the symptoms? Meanwhile, they go to the hospital or something like that.
I think that's the whole essence of having oral hygiene points in the community. We know that in the rural areas we don't have the basic medications. And for instance, for oral specifically, you don't need medication like, antibiotics, no. The main thing is water.
Treated water.
Yes.
Yes.
So it's a challenge, but the government with other partners are doing very hard to provide this basic necessity to community level. So they are, providing treated water to communities, their tanks, even here in Luanda. I must tell you that Luanda is not all urban. We have suburbs with rural areas in the country. So the government in every province is providing the necessary water although we know that it may not be sufficient, but all efforts are being done to provide quality potable water, treatment tanks, tablets to treat water at local level, yes, and follow-up of all the cases notified in the community.
Yes.
We have also teams, mobilization systems in the community, taking information to them so that once they have cases, okay, that present with vomiting, diarrhea, rapidly they take they're training how to treat water or go to the nearest
Yes,
or
absolutely, yes.
to get.
You can use salt and sugar
Yes.
water to do
Water.
the hydration of yes.
So for something.
All of these we teach the leaders in the
Community
communities.
leadership. Yes.
Okay, other than obviously you said that there's more cases in rural areas, urban areas which can help us in our project. What other patterns do you see in cholera cases? Certain age group, certain age group will get it more than others, certain genders. What other patterns are there that you can see in the cases?
Teenagers and
Yes, ages,
I think
genders.
it's because they depend on the adults, because the adults prepare the food,
True.
and if you don't have all we speak about washing hands before you prepare your food, after you leave the toilet, all these, even the water, to prepare the water. Normally the kids drink the water, right?
Yes.
From a mother that prepared or something like this. And I think it's more because they depend.
Yeah, the man. In terms of the patterns that we have, for instance, the information that we have, okay, is that we have less children below 1 year in our town, okay. So we have the number, the first time, the number, okay, the range that is affected ones, the adults, okay, that is from about 5 to 8. Almost everyone is attacked, but the ranges that are more attacked in adults than the children. We have cases under children, okay,
But not-
not many as compared to the other ranges. So
And more
it attacks
men.
everyone. Yeah. More men are something affected than women. Yeah,
So when you say washing hands, are you supposed to wash with running water or still water?
No, for you to wash your hands, you need to use, for example, what you call sabon.
so yeah,
For example, and then you cook. But if you don't have all these procedures done, you're gonna be cooking, preparing the food for all family, but you have your hands
Yes.
contaminated.
Contaminated.
Do you understand? You're spreading the cholera to all your family, the water as well.
Yeah, but just to answer your question, I think it's just water. When it's still running, the most important thing is that you soak when you're washing your hands. So, I mean, it's more effective to use soap with running water, for example, than washing your hands with still water. So, the most important thing is that you have water and soap. So,
Oh, okay.
you could agree.
yeah, absolutely. I mean, cholera is about what? It's a waterborne disease.
I
Okay.
can wash my hands,
Yes.
but if it's not effectively cleaned, I'm spreading it.
So if we invest in prevention at your level, this basic personal hygiene, washing your hands after toilet, keeping your food, not eating open,
Yes.
food around.
The flies.
The flies.
Yes.
Flies, yes.
100%.
So there are certain basic things that we can avoid so that we prevent ourselves. I think the best is prevention. So if we invest more in prevention, we are on track.
We're doing a lot of works in the communities, of course with support of WHO and UNICEF. For example, now in the cases houses, they offering to the families soap, things for hygiene,
Yes.
to improve the families. And they giving, I don't know what to call all
So,
products.
yeah, detergents.
Yes.
Yes, please. Yeah, absolutely.
Bleach, yes.
And meditation for
Rehabilitation.
Yes.
More or less.
in case something happened during the night, you can start drinking with safe water, because we also leave the tablets treated for treatment the water, and then in the morning you can go to the facility.
Other than ORS systems and other systems we implement, like the bleachers and the washing and stuff like that, I wanna know about the vaccine. Is it in Angola? Is it a lot accessible in rural areas, because I understand they are the most affected? Are there any side effects? How do you think about the vaccine, stuff like that? Just generally about the vaccine. Is it recommendable to take it, or instead they use like ORS or like no precaution that you were mentioning about they come to your house and need stuff like that? Yes.
I can say it's effective because Luanda was very affected with cholera, and once we gave the vaccination, the numbers went down. But we need to know that the vaccine is not like effective for a long period. You need to have the precaution, water and sanitation. Does it mean even if you took your vaccine, if you're still drinking unsafe water and the sanitation is still poor, you're gonna have the cholera.
So yes, the government has done a lot in providing vaccine is not readily available. So when we have vaccine, it is targeted, the areas where we have cases. So all the areas where we have cases, as it now, the government has made it possible that all these areas have vaccines and they are being vaccinated. We started with Luanda, okay? Evidence has it that with vaccine and taking all these other precautions and water, cases reduce, and they've reduced dramatically. So yes, all rural areas where they have cases, the government has done doing every effort to have vaccines being available at every point so that we are protected. Government is still acquiring, buying more vaccines so that at national level so that we vaccinate everything. But vaccination is not the only solution. So these other measures, okay, must continue. Sanitation, water.
You said the government does not have a lot of vaccines. They mainly focus on most affected areas. They not have a lot of vaccine because of the prices of the vaccine. For example, because the most affected areas, as you said, the rural areas. If the vaccine is costly, obviously we won't be able to afford it. Or is the government now having a lot of vaccine because of lack of research towards this?
No, it's not the cost. The cost is not the issue. It's the availability of vaccine on the market, because this is the cholera vaccine is not a routine vaccine. It is only produced when you request, when there's an outbreak. Okay, so through what we call Gavi, okay, supported international organizations that help countries, we've managed to get vaccines, and they'll continue, okay, to get vaccines so that the people are vaccinated. So the cost is not really an issue, but it's the availability on the market. But everything is being done so far. Every time we request, mechanisms are put in place through UNICEF and other programs, okay, to get as fast as we can, because we are not the only country that is having outbreak. Yes. Okay. So we have to fight to get them, but efforts are being done at every level to have the vaccines as fast as we request them, so that we save people. Saving life is our mission.
I'd like to go to one thing. Obviously, over here what I have is as of March 23rd of this year, 48.5% of cases of cholera have been in Luanda. Luanda, other than having the highest population in Angola, Luanda is the most urban city in Angola. So what other reason, other than overcrowdedness or overpopulation, will Luanda have the most cholera cases, even though it's the most urbanized city in Luanda?
But this is like Paulo said, Luanda looks like the most urban city, but we have also the center of Luanda areas that don't have this, how can I say, the infrastructure. Yeah, we have issues on this pillar, okay, and then this become a problem. For example, not now. This year we have Luanda split in No. We lost two municipalities, Polivengo and Isama, that are also rural areas, but we still have Belas. In Kakwaku we also have rural areas, Kazenga, and then it's an issue for us, for Luanda.
I just said, I think it's a couple of things. So as I mentioned, Rwanda has done quite a good job in terms of reducing cases. But initially, the actual outbreak started in Lyon. And it started in an area of Kabako that is highly congested. And don't forget that the population of Rwanda is around a third of the entire population of
Yes.
So when you couple the fact that Rwanda has the most amount of people in the country, plus the fact that the outbreak has started in an area that was very, very overpopulated, right? It's probably, you can see probably why you have so many cases. Of course, now we have, since the outbreak started, the government has invested a lot in terms of bringing qualified people, in terms of investing in, for example, vaccines, as you mentioned. But at the start of the outbreak, it wasn't like that.
We had
So,
challenges.
exactly. Now, of course, not just the government, but even us as partners, we're in a much better position to respond, which is why you're seeing cases drop. So that's probably why you have that. But if you notice, with the amount of cases you have, if you look at the last month or so, Rwanda cases have dropped significantly. So other provinces have now become the hotspot. So we're talking about Kwanza, Namib, that become hotspots. Wheeler, for example. London has done quite a job. But of course, if you take the cumulative number from the beginning, then it was seen as if Rwanda is really an issue. But actually, if you do an analysis, you understand that there's been a lot of work that's been done to reduce cases in Rwanda.
Absolutely.
We had to build the water pipe
Yes.
to secure the safe water on this community in Kakwaku.
And a lot of sensitization, community mobilization. And so even those that had doubts, because it's not easy for them just in a day to know. So we had to go there several times, to talk about the same thing, show them facts, because we had the numbers. Neighbor has lost a child. So after some time, people started going to oh, this is killing, this is true. And so there is that change of behavior towards, the information that we give them. So it has been a concentration of many activities.
Yes, we have to involve the army.
Army.
Yes.
Can you maybe tell us why the army?
No, because it's HR, no? We need to.
Resources.
Yes, we need to have all. It's because I said it's multi-sectorial. It's not only the health. We needed a lot of people there just to stop. These numbers was to be higher if we didn't involve all these sectors.
And also
Even
in the
for
beginning,
vaccination, we involved the army.
even in the beginning, people are refusing vaccination. Okay?
Oh, we had outbreaks in past, and we never heard about vaccine.
Yeah.
You understand? Why this vaccine? I can't make babies because of this vaccine.
SMS.
Yes.
You understand? And we need to sensibilize the people. Show researches. In Mozambique, they had the same problem with vaccine. The cases went down. In Congo, then you need to compare things just for them to understand and then accept.
Yeah. So it has been a process. Sometimes we've used even friends or community members who have lost their children to tell them to be active in them. Okay? I am in this community. I've lost my parents. Okay? This is real. Okay? And so people over time have, I think this is true. People are dying, so maybe I need to change. So over time, Rwanda has managed to be where it is because of a lot of efforts.
On these multi-sectorial actors, as I said before, the social communication, media is important because we need the media to open the doors for the professionals to speak about the disease, prevention, all of this.
So how do cholera outbreaks affect the hospital and health clinics in the city?
What I can say is we look a lot of people in hospitals, but we are not enough. And with this CTC, we had to build 2 CTCs with 50 beds each, 100 beds in Luanda. We need to move our human resources from the hospitals to this center because they don't work like 1 week through. They need to do split 24 hours, then rest, and then another team goes on. Then this becomes also very complicated.
Yeah.
Part of this training, we need to keep training. Until now, we are more or less 6 months from the outbreak, but we're still training our professional workers to respond to this situation. And sometimes we need to move from Luanda to another province to help this province. Because of the experience we have,
Yes.
then we need to move the professionals.
Yeah.
Yes.
Because as you can imagine, that no one is prepared for an outbreak.
Yes.
And so when it happens, people have to use all the means available to, so the Ministry of Health as well, we don't have enough human resource. Okay, there are centers that are managed by 1, 2, but when it happens, our aim is to save life. Okay, and so we have to mobilize, remove people, keep people from different, to go, and so that brings a strain on the health system. And so, but with engagement of the multi-sectoral involvement, we managed to. It is not easy because you have to look for resources from partners from everywhere, so that we all, fight the outbreak.
We will go towards ending it, okay? Now go towards your completion.
Okay.
Alright.
Right. Yeah. Before we wrap up, what do us as citizens and students of this society can do to help stop or spread awareness about this? Because it's not fair that only you guys are the one helping it. What can we do as citizens of society to put an end to this, or at least try to stop this?
I think also you are like actors on this, and you can speak about the cholera to not only your colleagues in school, but to other schools. For example, you're doing a nice job with this research, but we need to now see the other school. I'm speaking about international schools.
Yes.
I think GIS is one of the ones that is open to things like this. But what about the other teenagers, for example?
Yes.
You can open also a workshop as to speak. All the teenagers speak different schools to speak about this, and you're gonna teach what you know about the cholera to the other ones. Because we're speaking that people doesn't understand what cholera is. They don't believe. Of course, a lot of kids, they don't understand and they don't believe until they see. Yes.
In fact, we need both individual and collective, efforts if you have the right things. Okay? As students, as a learning institution, you have a very big role to play. I think we're talking of rural and urban. Probably just talk, but have you visited one? So probably one of the issues there is to visit these areas, understand, see the risks, the factors that are there, okay, and see how best you can help. We need a lot of sensitization amongst ourselves, the community, and everyone else. So there is a lot that you can do as an individual and as a collective, so that we all fight the outbreak. Efforts are being made, and we thank you for coming in with an idea, because sometimes youth to youth start with information is very good in this access. So everyone is welcome to join us. It's not only Ministry of Health, yeah? Every other sector, water, energy, there are all sorts of people that are involved in this fight. So we thank you very much, and we would want you to come on board so that together we can find a solution.
Thank you for joining us. Thank you for joining us today on our podcast and helping us further with our research of fighting cholera as a more prevalent infect in rural areas. Thank you very much for your time and for your efforts.
Thank you very much.
Beautiful podcast.
Okay.
Hey.